We would like to welcome Dr. Paige Harrison with LifeBridge Health. You are the medical director of integrative medicine. Thanks for
Mhm.
joining us.
Yeah, I'm happy to be here. Thanks for having me.
So, first of all, what is integrative medicine?
Yeah, so I'm doing my integrative medicine training at the Andrew Weil College of Integrative Medicine, which is at the University of Arizona. And I'm just going to take their definition first, and we can go off that. They define integrative medicine as the healing-oriented medicine that takes into account the whole person and includes all aspects of lifestyle. It emphasizes on the therapeutic relationship between the practitioner and the patient, and it's supported by evidence, and it makes use of all appropriate therapies. So the
Wow.
patient and the practitioner are equals in the healing process. Effective interventions are as natural and as least invasive as possible, and as low cost as possible too. So integrative medicine neither rejects conventional medicine nor accepts alternative medicine without criticism. And along with the treatment of the issue that the patient's coming for, health promotion and disease prevention is really emphasized.
Okay, it sounds so collaborative. So, what are the
Yeah.
benefits of integrative medicine?
So it's really, again, focused on the health promotion and disease prevention versus just focusing on the treatment after the disease has already happened. And like we talked about before, the recommendations are usually low to no cost. And they're really comprehensive, so they can tackle more than one problem. So, for instance, like making dietary recommendations or changes can address not only gastrointestinal issues, inflammation, mood, and that's just all from changing one thing. The other really important thing that I think sets integrative medicine apart is the time that's taken with the patient, with the provider. That's rarely seen right now because insurance companies and other forces are causing doctors to have to pack patients into their day and not being able to spend time with them. And that's not always a healing experience for patients. So,
So, let's dive deeper into which conditions you could treat with this approach.
so I personally believe that everything can be treated with an integrative approach, but the evidence is strongest for chronic pain, specifically back pain, any sort of inflammatory condition, headaches, fibromyalgia, gastrointestinal complaints, and mood disorders like anxiety and depression.
And what treatments do you commonly recommend for patients?
So each patient has a unique set of genes and a unique set of circumstances that has had an effect on those genes to be the person that they are when they're walking in my office at that time of their life. So every person is going to have an individualized plan of care. And we do an in-depth intake and a review of history prior and during the first evaluation. But typically, the treatment plans look like dietary changes, some lab work to look for deficiencies or abnormalities, supplementation, looking at their lifestyle, their stress, implementing mind body strategies, and referral to complementary providers like an acupuncturist.
Hmm. Is integrative medicine just for adults, or can kids also benefit from it?
Yeah, so I actually think that pediatric patients should reap the benefits of integrative therapies. There's actually been several studies that have shown like about 50 to 60% reduction in emotional dysregulation, inattention, and aggression in children with ADHD just by implementing a whole food, nutrient dense diet. Or by supplementing with a high quality multivitamin. So I think that it's probably even more important for pediatric patients to get a detail oriented and lifestyle based plan of care to set them up for a successful and healthful life.
Wow, just with a change in the diet.
Diet,
That's
yeah,
incredible. Yeah.
yeah.
Are there any integrative techniques that people watching at home can do?
Yeah, definitely. So, one of the easiest and most common recommendations I make for kind of all my patients is to increase the amount of vegetables that they're getting at every meal and every day, and to really vary the colors of the vegetables they're getting, just to make sure we're optimizing the micronutrient profile and the polyphenol profile. And I like to explain to my patients like the foods that we eat are like the materials you would use to build a house. And if you use bad materials, you're not going to have a house that lasts very long or works very well. And along with adding the vegetables, we talk about reducing the processed foods. So, in order for our bodies to make hormones that we need and neurotransmitters we need, like serotonin and dopamine, we need these minerals and vitamins as cofactors. Like we can't make serotonin and dopamine without vitamin B6 and zinc, etc. So we really can't sustain a diet on processed foods alone. So that's a really simple recommendation that everybody can do at home.
Okay, eat more vegetables.
Yeah.
Cook them for your next meal. So if someone wants to explore integrative medicine treatments at LifeBridge Health, what do they need to do?
Yeah. So they can call 410-601 6416 to make an
Okay,
appointment with
excellent.
me. Yeah.
Excellent. Dr. Paige Harrison, thanks so much for joining us. We learned a
Yeah.
lot and we will all be eating more vegetables.
Yeah. Thank you so much for having me.